The opinions expressed in the following program are those of the participants and do not necessarily reflect those of Rogers or Rogers TV.
Welcome to Health Matters. I'm your host this evening, Dr. Lana Marconi. On tonight's show, we're going to explore up-and-coming trends in traditional Chinese medicine, such as head massage and hand diagnosis. We're also going to dive into their ancient practice of tongue and pulse diagnosis. Have a mirror on hand so you can examine your own tongue later on in the show. Before I introduce my first guest, I need to tell you about a poll question for tonight. Here's your question. What energy-based exercises do you prefer? Qigong, Tai Chi, yoga, or Aikido? Let us know, rogerstv.com/healthmatters. And now my first two guests. Please welcome Melinda Wu. She is the admissions director for the Ontario College of Traditional Chinese Medicine. And we also have Wang Hong. She's a doctor of traditional Chinese medicine, also from the college. Welcome, ladies.
Hi.
Hi.
So glad you're here this evening.
Me too.
Yeah.
Okay, so the college that you work at was founded by your father.
Yes, it was founded in 1998 by Dr. Wu.
And the college is where?
It's located in Markham, Ontario.
Okay, nice, nice. And what types of programs do you have at the college?
We offer variety programs, 2 years acupuncture diploma programs, 3 years TCM practitioner diploma program, and 4 years advanced TCM diploma program. And also certificate courses such as Wu's head massage.
And I understand you have a book giveaway for our lovely viewers this evening based on a technique that your father developed,
Yes,
correct?
do.
Okay.
It's called the Dr. Wu's head massage.
Folks at home, if you'd like a copy of this book, please email me at giveaway@drlana.com. I'm taking the first 5 emails. Also, if you have any questions for my expert panel this evening, give us a call at 905-595-LIVE. All right, Melinda, how did your father develop Dr. Wu's head massage?
Well, that was a long story. In 1972, after he graduated from high school, he was caught up in the Chinese Cultural Revolution. So all the university was closed, and then students had to send to the village for labor training. So he went back to his hometown to learn Chinese medicine with his uncle. And one day he had a severe flu and headaches. An old Chinese medicine doctor gave him a 10 minutes head massage, and the pain was immediately relieved. So he got really interested and he became a apprentice under the old doctor. After that, he continued his study in TCM University. He spent 20 years to develop the Wu's head massage.
Nice. And I understand that 2 of the main areas that the head massage focuses on is the face and the head. So Wong, we're going to post a photo of the head massage, and maybe you can help viewers go through it in terms of the areas of the anatomy of the body that the face massage actually accesses when you touch that, right?
Yeah.
Okay, so we're going to post a photo on the face map of Dr. Wu's head massage. That's going to come up on the screen. And just basically, there it is on the screen. So just tell viewers, what are we touching?
Yeah, Dr. Wu designed this picture on his face. Like we can see are different organ, your whole body organ, and your face different area. So when we do the massage, we will just follow the ideas, different organ in a different face area. For example, we can see your heart is in between your eye, and your liver and spleen is on your nose. So when you treated the patient, we push and massage that area, we will increase or stimulate that area, increase the organ function, and improve your health condition.
Yeah, you can also see from the photo that I think the knee looked to be anterior and superior to the angle of the mandible.
Yes.
You have the spine that seems to be in front of the earlobe. The shoulder, which is on the cheekbone, just below the outer canthus of the eye.
Correct.
So you're touching a lot of the limbs,
Right.
The nervous system, and looks like a lot of the organs. By
Right,
touching
correct.
the face.
Yes.
Okay. So what's the theory behind Dr. Wu's head massage?
Well, the theory was based on an old Chinese medicine textbook called the Yellow Emperor Canoe of Internal Medicine.
And also in our Chinese traditional medicine principle, is all yang, and in China we call the meridian channel across the head. So we massage and treatment that channel can improve your health condition and treated your disease in your body.
One of the things that I appreciated from reading the book was that, I mean, you get to learn about acupuncture points. I mean, there's at least 40 points that you learn about. I remember one was right here in between the eyebrows. Some call it the third eye, but in your language it's yin tong,
Right,
correct?
yin
Right,
tong,
and that
yes.
helps with relieving anxiety and irritability and helps with frontal lobe headaches, correct?
Right,
And
yeah.
there's another point that I really liked that was just above the anterior hairline. It was due 24,
Right.
and that was to quiet the heart and calm the spirit.
Yeah,
Right?
that's right.
Very nice. So just in general, who would benefit from this type of massage?
Oh, our like head massage, like a common massage, they can help to treatment a lot of kind of the disease, like internal disease, neurologic disease, like a stroke, but head massage is specific in the computer using relative disease, like people working in the office, we call the office group people, and they always feel the heavy shoulder, vertical headache, stress movement, like that. Also, head massage can use in anti-aging and anti-obesity, loss weight treatment, and right now, there are more and more disease and use treatment by hand massage.
What type, because I noticed you also touch the head, so what type of areas are you stimulating on the head and the brain?
Oh, we were, practitioner use their two hands to touch patient's face, our neck, shoulder, and from the face, we were until the lateral and the back, also including the top.
So on the brain, I noticed what fascinated me was one of the areas was the motor cortex that gets stimulated. And back in the 1800s, I think it was 1870, there was a German neurologist who actually discovered that vertical strip
Right.
by stimulating a dog's brain. And when he stimulated a certain part of the dog's brain, the muscles would contract.
Yes.
And when he damaged that part of the brain, the
Yeah.
dog became paralyzed.
Yeah.
And then years later, a Scottish neurologist
Yeah.
stimulated another animal, and from that was able to give a rough map of the human body on the motor cortex, starting with the feet towards the top of the brain,
Right.
and the face towards the bottom of the brain. So the strip runs like this. So when you're doing Dr. Wu's head massage, you're actually massaging a person's entire body without even touching their body. This is all accessed through the head, and this is backed by science.
Yeah, you're right. By the Dr. Wu's method, we have like a motor area and a sensorium area in the lateral of hand. We also have a body balance in the back, and a visual area and a speech area, and also we have the acupuncture point in the top. We treat that acupuncture, it's really, really improved.
So can you demo some techniques that you would do on your face? Or,
Yeah, sure. And in a clinic office, we always let patient lying down. But we just use our hand to do more than 60 movements in head massage and cover.
So what would you do on your face? What would you do?
We have like a lot of the technique. More than 10 Chinese traditional tuina technique in using a head massage. So like we were pushing, kneading the acupuncture and swiping, and we were rolling, and also we will do some in the shoulder.
Nice,
Yeah.
nice. And anyone can learn this massage.
Oh, of course.
Right, they would go to your school to learn
Of
this
course.
massage. You know,
Yeah.
one of the quotes that I liked in the book from your father, he said, in TCM theory, energy never really ends, it transforms into something else, so that an end is often really only a beginning. It's so poetic. Very, very nice. Melinda, what else do you do at the school?
I'm working as a admission director at the school, and also if anyone interested, they can come for our teaching clinics. Our teaching clinic is offered to the public. If you want to get treatments at an affordable price, you can come and call us or visit our website.
And just quickly, we do have a photo of your father to put up, and he's in this photo, I think he's doing the head massage on this photo. There he is. There's Dr. Bin Wu. What's he doing in this photo, Melinda?
He's performing a head massage. This is one of the techniques.
That's one of the techniques, and
Yeah,
there's about 60 movements. Okay. Well, hey, you know what? Thank you very much, ladies, for coming down to the studio today and sharing with us Dr. Wu's head massage. And all the best to you.
Thank you.
Thank you. Yeah. We'll be back more on Health Matters and more on TCM. Stay tuned. Want to quit smoking naturally? The Journal of Chinese Medicine reported research results showing that laser acupoint stimulation can assist in smoking cessation by reducing physical symptoms of withdrawal. Welcome back to Health Matters. We're exploring traditional Chinese medicine this evening. Now we're going to dive into tongue diagnosis. Get your mirror ready to examine your own tongue at home if you like. With me to explain tongue diagnosis is registered traditional Chinese medicine practitioner Inga Spatari and her lovely model Maria Kravchenko. Welcome, ladies. All right, Inga, tongue diagnosis. Right? Okay, so we're going to start the exploration of tongue diagnosis by putting on a photo of the map of the tongue so people at home can understand the map of the tongue. Well, Inga is going to take us through this map of the tongue. Okay, so on the map of the tongue,
Chinese medicine conventionally divides the human body in 3 parts and calls it burners: a low burner, middle burner, and upper burner. So as you see on your right picture, the low burner includes the guts, kidney, urinary bladder, genital area. Middle burner includes the stomach, spleen, pancreas, and upper burner includes lung and heart. And the black line divides it exactly into a shape of a tongue.
okay,
And exactly this way, the organs are projected on our tongue. The root of the tongue, the low part, shows the functional state of the kidney, bladder, uterus. The central part shows spleen, stomach, pancreas, and the anterior third shows the lung and heart.
the lung and heart on the
lung
tip.
and heart,
Okay.
yeah, on the
Yeah,
tip.
that's great. So viewers at
yeah.
home can get a sense of what the map of the tongue looks like. Okay, so
Absolutely.
to understand tongue diagnosis, you're going to talk about the tongue body, right? The color of the
Right.
tongue, the tongue shape, and then the coating on the tongue. So
Exactly.
the tongue body, a healthy tongue is pink.
A healthy tongue is pink. Yeah,
But
that's
a
true.
tongue that's not healthy, or a body that's not healthy, is going to show different colors on the tongue body, correct?
Correct.
Okay, so what type of colors are we looking for?
We are looking for purple color that would indicate blood stagnation. We are looking for pale color that would indicate yang deficiency or blood deficiency. We are looking for red scarlet color that would indicate yin deficiency and heat. Bluish purple color would indicate cold, and reddish purple stagnation from the heat.
So if somebody's tongue was purple on the sides, that would be blood stagnation on the liver.
Right, because
Right,
the
that's-
sides part belongs to
because
the
the
liver.
side belongs to the liver.
Yes.
So in the center of the tongue, if it was really red, that would be heat in the stomach or
Exactly.
spleen.
Right.
Is that how it works?
It is
Yeah?
exactly like that.
Okay.
Yeah.
So you want to keep in mind the different colors when looking at the organs that are mapped out on your tongue, right? So and
Right.
pale is deficiency.
Pale is blood deficiency or yang deficiency.
Okay. So if the tip of your tongue was pale, that would be the heart. The energy of the heart is
Heart
deficient.
blood deficiency, heart yang deficiency. You have to see the whole body.
The whole body of the
Yeah.
tongue. Okay.
Yeah.
So we have lovely Maria over here, and just by the way, Maria is actually from Israel. Is that correct?
Right.
Israel, and she's studying here in Canada at the Ontario College of Traditional Chinese Medicine, studying acupuncture.
That's right,
And
so-
you hope to take acupuncture back to Israel.
I do, yeah, and Inga
Nice.
is my teacher, actually. Yeah.
Nice. Okay, so Inga, show us through Maria's tongue. I mean, to viewers at home, what they should look for.
So as you open your mouth, you look at your tongue. First, you want to see the color of the tongue. And Maria's tongue is slightly pale, dark pale. Thank you. That's first criteria that you're looking for the color of the tongue, right? And this color would speak about blood deficiency and a little bit of blood stagnation. Start of a blood stagnation, yeah.
Like stagnation all over in all the organs?
Right. It's a general body blood stagnation because we don't see it in a particular area. It's just the whole tongue color. Yes.
Okay. Okay. So let's talk about the tongue size or the shape.
Tongue shape, it's also a source of information, great source of information. The tongue could be swollen, big, that speaks about damp or phlegm. The shape could be narrow, that speaks about heat. It could be with teeth marks, that speaks about spleen deficiency, can be deviated, that speaks about wind, can be short, that speaks about hint deficiency.
So what is the shape of Maria's tongue?
Once again, Maria's tongue.
Is it swollen?
It's, may I have a better look? It's not swollen, thank you. It's quivering and
It's what?
it's quivering, you know.
It's quivering.
Quivering,
Quivering.
yeah, a little trembling that in Chinese medicine speaks about spleen qi deficiency. Yeah, that's what I can say about
Do you look
the
at the papilla on top, the tiny bumps?
Yes, we do. We watch them when we inspect the coating of the tongue.
The coating of the tongue. Okay.
The coating of the tongue.
Okay, so just for folks at home, the papilla contain the taste buds.
Oh, absolutely.
Right, there's about
Yeah.
10,000 taste buds on the tongue that contain up to 100 taste cells that have little hairs on them that send messages to your brain and helps you perceive whether you're eating something that's salty, sour, sweet, or bitter. All right, let's look at the tongue coating.
Tongue coating is another source of information. Here I can say that Maria's tongue coating is thin and yellowish, thank you. That speaks about heat.
That speaks about heat.
That speaks about heat, mostly in middle burner, like I would say digestive area.
Do you have digestive issues?
Yeah, for quite a long time, yeah.
My understanding about the tongue coating is that if it's a thick coating, that reflects the degree of the depth of the internal pathogen. And if the tongue coating is thin, that reflects a prognosis.
Exactly. The healthy tongue coating should be white and thin, not thicker than you can see the color of the tongue body through it. And if it's thicker, that speaks about some pathogen factors like dampness. But if there is no coating at all, that's also bad because it speaks about yin deficiency.
Okay, and briefly, what is yin deficiency? Just briefly.
It's pretty complicated to say briefly because it's such a complicated concept, but in few words, it's a moisture, it's a cooling system of our body. And if yin is deficient, there may appear like dry throat, dry mouth, night sweat, hot flushes, even low back pain.
And if yang is deficient?
If yang is deficient, symptoms of cold. Patient feel cold, there is digestion problem, bowel movement become loose.
Their tongue would be pale?
The tongue will be pale.
If it's yang deficient? Okay.
Absolutely.
Okay. Talk about the moisture of the tongue.
Moisture of the tongue should be neither too much moist, neither dry. Maria's tongue's moisture is fine. Thank you.
All right.
If the tongue is dry, that speaks about either form of dryness, either indeficiency, not enough body fluids, either heat that is steaming and drying up the body fluids. And if the tongue is over moist, that's also bad because it speaks either about yang deficiency or about spleen that is not transforming and transporting the body fluids.
And what about the sublingual veins?
Sublingual veins.
You're gonna flip. Flip it up, Maria.
Let's go.
All right, beautiful sublingual veins. Thank you. Why I say thank you. Why I say beautiful because they are healthy. We don't see much from Maria's sublingual veins. They are right the way healthy veins supposed to be. Otherwise, you can see the veins that are pretty swollen and dark purple, like serpentine. And sublingual veins speak also about the pathogen factors, and they also speak about where it is located, lower burner, middle burner, or upper burner.
So just generally, what has this information told you about Maria?
Generally, of course, the tongue diagnosis is not enough, right?
Yeah.
Like
It's one piece.
It's one piece, exactly. Right now, I know that there is blood deficiency, starting blood stagnation, spleen Qi deficiency, and heat in middle burner, heat and spleen stomach.
Does smoking, medication, spicy food change the color of the tongue?
Absolutely, absolutely. Spicy food and medication change even the color of the body of the tongue. And drinks change the color of the, yeah, they change the color of the coating of the tongue.
So just quickly, what is the worst tongue you've seen?
Well, unfortunately, I happened to see one very sad tongue that made me feel sad. That were a few young girls that were in one town that was during my PhD studies in China, in a small town, and they were having purple tongue and that speak about blood stagnation, but on that tongue they also had a very dark big spots, also black, that speaks even about more severe blood stagnation. And all of them were having gynecological disorders. And while I saw it, I asked myself, how can it be in the same area you see in one day few tongues that you don't happen to see through, I don't know, 6-7 years of my being in China? How does it happen? And then I just remembered that on the way towards this town, I smelled a funny smell, and I asked the driver what's that, and they told me it was a factory that was doing something chemical.
So you link the chemical factory to the problems in the person that was showing up on the tongue. Okay, ladies, we're going to take a quick break, and we're going to come back with pulse diagnosis, more on Health Matters. Acupuncture that elicits the sensation of de qi can improve facial muscle recovery, disability, and quality of life for patients with Bell's palsy. Journal of Chinese Medicine. Welcome back to Health Matters. We are exploring traditional Chinese medicine. Up next is pulse diagnosis with registered acupuncturist Inga Spatari and her model, Maria Kravchenko. All right, ladies, pulse diagnosis. Let's just start with here in the West. The way we take our pulse traditionally is using these two fingers and placing them on the radial artery. Typically, 60 to 100 beats per minute is in the normal range. Anything above or below that could pose a problem. In Eastern medicine, it's very, very different.
Absolutely.
It's very complex,
yes.
And it's an art. So show viewers at home, I guess, how to place our fingers and really what information we're getting from doing that.
In Chinese medicine, we also use the radial artery, and we place our middle finger on a radial bone just next to the styloid process, and then the index finger and ring finger next to them, this way, like that. So we take the pulse first superficially, looking for the state of the qi, then palpate, find it deeper, looking for the state of the blood, and then even checking it deeper, the root of the pulse.
So we have 3 levels that you're checking.
Yes.
Okay. So three fingers, 3 levels. The first level is the level of qi, the level of our energy.
Yes.
The second level is the level of blood.
Of blood.
And the third level is yin,
Root.
the root.
The
What does that
root.
mean? Just generally.
Generally, talking that the pulse has root, that means that the pulse has a very good qi, has a very good source of energy coming.
Okay. So you're using her right arm.
Right arm.
And we have both yin and yang organs. So did you explain that yet?
No.
Okay.
So from the right hand, we check the functional state of the yang organs. Under my first finger, here is a lung. I'm checking the lung. And then there will be spleen and stomach, and then kidney and urinary bladder. So we take the pulse, all 3, at the same time, and then we check them one by one, like lung, spleen, stomach, kidney, urinary bladder. And on the left hand,
But the other organs, like if you're pressing more distally distal
I understand what you mean.
as
Yeah,
opposed
exactly.
to proximal,
Yes.
you're going to get a different organ.
Exactly. If we press distally, like in lung position, the distally is lung and proximally is large intestine. For the middle finger, proximally there is stomach and distally is spleen, and exactly the same the third position. Proximally is urinary bladder and distally kidney, uterus, that gentleman prostate, and even knees. Like if the pulse would be slippery here, we could think that there might be an arthritis.
Sure. So there's 6 organs that you're checking.
Yeah, pretty much
On that
6
hand.
organs, even
And what
more.
about on our left wrist?
On the left wrist, pretty much the same. Like naming the major organs would be heart, liver, kidney. So together with heart, here we are checking the small intestine that goes proximally, and the heart goes distally. Gallbladder is distally, and liver proximally, and kidney and urinary bladder, they are both here, exactly the same, proximally. Urinary bladder, and distally the kidney.
Okay. So what are you feeling from Maria? I know, like, you're under pressure right now.
Well, I
So-
just need some to concentrate on it. Maria's pulse is wiry. Probably she's also under the pressure because wiry pulse, it's a sign, could be a sign of stress.
Maria, you're not stressed,
So
are you?
there's all kinds of conditions you're looking for?
When we are taking pulse, we are looking actually for 28
28 different types of pulses.
28 different types of pulses.
Okay.
Of course, luckily not all of them are present. Like most often there is wiry pulse, slippery pulse, thready pulse, rapid pulse,
Okay.
floating pulse.
So
Yeah.
what does a wiry pulse feel like?
Wiry pulse feels exactly like a string under your fingers.
Like guitar
you
strings?
Yes,
Okay.
and you feel a string. And it's interesting pulse. It can speak about quite a few things. As you already heard, it can speak about stress. It can speak about pain. It can speak about liver chi stagnation, and it can speak about internal wind or even external wind. That's why it's important to make the diagnosis together with inquiring the patient and checking the tongue.
So if you're feeling wiry in the liver position,
Right.
then in the third position here, then that'll tell you what? That there's stagnation in the liver?
A liver chi stagnation.
And that could be due to, because in Chinese medicine, the liver is related to anger. Could that be
right.
the culprit? One of them.
There is obviously a connection. It could be anger, it could be just stress, it could be just emotion, and as I said, it could be liver chi stagnation.
Could it be during a woman's time of the month
Yes, it could.
that you would feel that?
Yes.
Okay. What about a slippery pulse?
Slippery pulse, it's another interesting kind of pulse that is pretty often. It feels like pearls beads under the fingers. That's how it comes and slips and runs away. And it can speak, again, about quite a few things.
Like what?
It can speak about phlegm, dampness.
Did you feel that in Maria?
Maybe, let me check the right hand, because the left one was wiry. Slippery, yes, spleen, stomach,
Yes,
slippery.
I already know that.
Yes, slippery pulse is more characteristic for the right hand, for spleen and stomach, because spleen is the one in charge of creating dampness and phlegm.
So what does that mean? Like, how do you translate that to a patient? Well, you have a slippery pulse
I
and
can
your
tell
stomach
maybe how it
spleen.
manifests in me, because I
Sure,
know
that'd
I
be
have a
great.
slippery
Go on.
pulse.
Yeah.
So there is like maybe a lump in the throat, like a feeling of, or you have like expectoration of phlegm, for example, or a feeling of heaviness.
That's exactly the typical case of dampness. I would explain to patients that this is the pathogenical factor that shouldn't be in your body, and it's created by the wrong function of some energetical organs.
If a patient sees you at 9 a.m. and then sees you at 6 p.m., is their pulse going to change?
There is a possibility that it will change. Huan Dineding, Yellow Emperor's Canon, says that ideally pulse should be taken in the morning when the patient just woke up and didn't even stand up of the bed. That's ideal. So if in the morning there was one state of the pulse going through a stressy working day, by the evening pulse quality could be changing.
What's more reliable, the tongue or the pulse?
The tongue.
Why?
Because pulse is changing too fast. Let's say a patient on the way to you pick up the phone and had a extremely good news. His pulse would immediately change. That's why we ask patients first to sit down and calm. And then we
So
take
is the
pulse.
tongue more indicative of chronic conditions?
Yes,
And the pulse is more immediate conditions?
exactly. Yeah, you can say like that. Like colds, bad colds, I would read them from the pulse, because the pulse would become floating. Immediately doctor has a feeling like a fish under the fingers. And while it doesn't show on the tongue, at least first couple of days.
Can you tell if a person's pregnant or if they're going to have a boy or a girl?
Yes. Well, now we have ultrasonography.
Well, but back in the day, see,
but
back in the day, 5,000 years ago, there was no X-ray machine, so this was their way, the ancients' way of checking our
Absolutely.
internal organs, right?
that's what they did. They took the pulse.
They were very in touch with their bodies and with
yes.
nature.
Yes, so if the pulse was slippery and there is particular quality of that sleepiness, it's more slippery than just dampness, then they would suppose that the lady is pregnant. And since the left hand is in charge of yin and the right hand is in charge of yang, where pulse is stronger, that was the expected gender of the baby. So if the pulse was strong on the right hand, they would say that she's expecting a baby boy. And if it was strong on the left hand, they would say that she's expecting a baby girl.
Yes, interesting. Okay, here's a question for you. Holiday times, Christmas time, let's say people are partying, eating a lot of rich food, drinking a lot of alcohol. What would their tongue and pulse look like?
Catastrophic. The pulse would immediately show that slippery qualities that would speak about too much rich food, too much cold food, maybe even indigestion if overeating. And the same pulse could be wiry because overabuse of alcohol overabuses the liver, and right away liver is responding by a wiry pulse. And on the tongue could appear as a picture of patches without a coating. That says that the stomach energy has been hard at the degree that stomach can recover.
Well, thank you very much, Inga, for explaining tongue and pulse. Maria, you're going to stick
My
around for
pleasure.
hand diagnosis.
Yes.
Up next, hand diagnosis. Stay around. An Australian systematic review has found support for the use of acupuncture as a means to enhance exercise performance in post-exercise recovery, Journal of Chinese Medicine. Welcome back to Health Matters. We're exploring aspects of traditional Chinese medicine tonight, such as head massage, tongue and pulse diagnosis, and now we're going to dive into hand diagnosis. Please welcome registered acupuncturist Alice Au and our lovely model, Maria Kravchenko. All right, Alice.
Hi.
Hand diagnosis. What's the theory with that?
Oh, hand diagnosis is based on the theory of the biological holograph. Through the observation, verification, noticing, and the mind indication. Same as the reflexology, but it's not on the feet, it switches on the palm.
On the palm.
Yeah.
Interesting. I was on the website of the Journal of Chinese Medicine. They had a book called Chinese Medical Palmistry, Your Health is in Your Hand, and it states that in Chinese medicine they believe that the body is a hologram, and that the entire body is mapped on various body parts, and that changes in one area of the body can reflect disease in the other area. So that's what you're saying,
Yes,
correct?
yes,
Okay.
yes.
So, and can you show us then with Maria's hand, maybe what our organs are, or the map of our body on our hand?
Oh,
Can you
sure.
take viewers through that so
sure.
they can, look at their own hand?
Okay. Okay. For the hand, we mostly will be watching. For the hand, it's because it's the reflexology. This is why the head area will be showing on here. And then this is for our mouth.
That's the mouth?
This is the mouth. And for this side, this is our fatigue area.
The what area?
The fatigue.
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 Yes. And on the side below the index finger, the ring finger, that is our lung. The lung area will be shown here. And also here will be pericardium. Below that will be the spleen. And go back to the center, this one will be the stomach. And on the side here, that is the heart. On the side here, back to the pinky, below the lung, that is the colon area. And below here is the blood sugar. I simply say this is the diabetics area.
Okay.
And for the center here, this is the kidney and the reproductive organs.
Mm-hmm. And what are you seeing on Maria's hand?
Let me see. She's sleeping very late.
You sleep late, Maria?
I am.
She's studying too much, that's why.
And she's also have a lot of phlegm and also feeling dryness on the throat.
You feel dry under the throat?
We're just talking about it, that I have phlegm in my throat.
Maybe she has the history for the smoking.
Do you smoke,
Which
Maria?
I do. I'm not now, but I do have a history. How can you tell that?
Because on the throat area, you're getting a maroon color. We base on the color of the hand, and then we will see this one belongs to a maroon color. It belongs to the chronic disease. Or if the acute, that will be showing this more on the white color, pink color, or even it's getting more red color.
So it's chronic then?
Yeah.
Because I was smoking for
a long time, so it's still
years.
showing up on your hand.
Yeah.
Yes, yes. And also on the center, the stomach, this is getting more light color. This means that she's also suffering for the digestion problem.
As we said, right?
Yeah. And sometimes maybe suffering for the blowing sensation after it.
Yeah.
And you maybe need to do some more cleansing on the colon. One thing you need to more worry about is sometimes you have the irregular palpitation.
Oh.
Do you have that?
Which I do. Yeah.
Irregular
I'm
palpitation?
in my midterm time right now, so I do have.
That's so fascinating how your symptoms are showing up on your hand.
It is.
Yes.
Feel exposed.
And we not just only see the palm, it's also we can see on the side of the back of the hand.
Oh, we're going to turn her hand around.
Yes. That's why we can see the prominences of the wings. For this lady, she's not much of the wings is showing up. This is the good sign, because if we see the wings is pop up on the side of the hand, this means that this people is suffering a lot of the arthritis or a lot of the problem on the hand, shoulder pain or the knee pain or this.
But you're not seeing that on her hand?
No, it's not reading for her.
So is that the spine, Alice?
Yes, this is the spine. Now I'm checking her thoracic.
So for the spine, are you getting the entire spine? Are you getting C1 to C7 and T1 to T12 and L1
yes,
to
right,
L5?
exactly. All the whole spine is showing here.
Okay.
And then she also has some back pain.
No back pain.
No back
Not
pain?
Back pain. Okay, so good. And this side, both side is the pelvis.
Okay.
That's the pelvis. And on the side here, this is on the hand and the arms. And on the side, both side, belongs the reflection of the foot.
Okay. What about her nails?
Okay. The nail we show, because we also see the nuna, all this nuna, you see this is the white nuna. If this is more a milky color or white color, that's more healthy. And also this nuna is not more than 1/5 of the total nail. If this is getting more, this means there are more access. But she is just good for 1/5. And if all the finger shows that has all the nuna is showing up, total 10 fingers, minimum 8 to 10 fingers have the nuna. This means that for the energy for these people is very strong. If there's no nuna is showing up, that means that the energy, the chi is very weak. That's more on the deficiency type.
Alice, I want to ask you, on the website for Stanford University, their medical department, they had nail. They have a course on nail pathology. So they had these gruesome photos on their website, and there was one nail where they had a transverse band on the distal end, and it was brown, and that indicates kidney disease. Is that true in Chinese medicine as well? And also, before you answer that, on the middle part of the nail, there was a transverse band, and it was white, and that indicated heavy metal poisoning. So is that the same in your culture as well?
Yes, because we have 6 meridians go through to the hand.
Right.
And then this is each of the finger shows us related which of the meridian. For the thumb, that is for the lung and the large intestine. And then this one is for the spleen and also for the stomach. And also for this one is for the heart. And also for this is related for the kidney. And all this is different of the meridians go through to our hand. And already you're asking for if you see the fingernail have different of the strip, it means that these people may be suffering for the very serious disease before. Or maybe they have a very severe of the disease coming soon. And if this is on the side, they have a break on the middle, this means that they have a very seriously of the cancer or more worse. But it depends on happening on the which finger.
How else does cancer show up on the hand? Is it with black?
Oh yeah.
Are there black dots?
If we see the hand on this, just only the white dot, that means that the starting have the inflammation.
If you have white dots on the hand.
White dots. Yeah.
Inflammation.
If it's getting more pinky, that means that this inflammation is getting more serious. But if going on red dot, that means that it's already have the internal bleeding. If something is showing on the stomach, mostly they will have the ulcer inside the stomach. But if this is a black dot with a jagged on the side, that means that is the cancer. And then it depends on which is the location
where the
organs are.
So you're looking at the size of the hand, the texture of the hand, if there's nodules on the hand. All these things come into play when you're looking at the hand. And do you do this, is this part of your observation, your clinical observation when a patient comes in to see you?
Yes, this is one of the main of my observation and the diagnosis for the disease, because if we practice more, 100% is correct.
Right, right. And what does a healthy hand look like?
Oh, this is a pinky color.
That's it, just pinky?
Yes.
Is it smooth?
And smooth will be not smooth. If too smooth, this means that maybe you have the cholesterol.
Is it healthy? Am I healthy?
Yes. For your hand is not completely is the healthy, because you still have the white dot all over. That's why you still have the dampness inside. The dampness.
So similar to how our pulse changes throughout the day, does our hand change throughout the day as well?
It's changed. It's the morning time, there's even morning time, afternoon time, evening time. Every three times you're checking, totally different.
How old do people need to be so you could read their hands?
Starting for 4 years old kids to senior.
To senior,
Yeah.
4 years to senior, okay. All right, ladies, we're gonna take a break and we're gonna be back and you're gonna show us how to treat our body by treating our hand, correct?
Yeah.
All right, more on Health Matters with Alice Wu and hand therapy coming up next. Acupuncture is cost-effective for the treatment of chronic pain, according to a systematic review carried out by UK researchers, Journal of Chinese Medicine. Welcome back to Health Matters. We're exploring aspects of traditional Chinese medicine. Tonight with me is registered acupuncturist Alice Wu and our model Maria Kravchenko. And we're talking about hand diagnosis and hand treatment. Okay, Alice, I read an article in Global Times. There's an interview with a Hong Kong Canadian expert in hand diagnosis. Her name is Dolores Chung. And she says that our hand mirrors our health. She uses the analogy of a tree. And she says, a tree is like our body, and the leaves on a tree are like our hands. And so when the leaves start to dry up and turn yellow and fall, I mean, that's showing signs of sickness within the tree. So it's the same thing on the hand. And she said that by stimulating the organs on our hands, we can bring into balance the organs within our body so as to fight disease.
Yes, absolutely,
Yes?
that's right, yes.
Okay. Now you're going to show us with Maria how to stimulate her organs by stimulating them on her hand.
Yes.
Okay.
Mhm. And then if
Yeah.
this is actually we have different. For the lady, we need to reading on the right hand.
On the right hand for the
And
lady.
then yes, and then for the gentleman, we read on the left hand.
Okay.
Okay. The treatment is we based on your hand, the location. If they have the headache, because this is the reflection of the head, therefore we'll be going on using some of the tools. Even for the pain, we still can be doing. We can be just scraping on this here. And if they have suffering for the arteries is getting blockage and then have showing the blue lines here, we can be just slightly to massage on here. And then firstly they may be feel pain, but with getting more, this one will be reduce all the stagnation on the neck, and then also can be reduce the stroke, the
So how
advance
long
of
should
the
they
stroke.
rub that?
Until you find that this area is getting, the mark is gone. That is, and if this is suffering for the example, you have a big dinner, it's very full. That's why you feel the very full on the, and there are lots of gas on the stomach. And also you can be massage here, and then you can using the some of the tools to just keep continue to rub it, or even you can using a thumb to just massage it until you feel that the gas is gone, and then you will feel more comfortable. And then you can do it on both sides, and then you massage, and then you can slightly, don't press too strong, because
Okay.
you will get maybe get the stomach is getting too much stimulation. This is why that when we do just only slightly, but take time more longer.
Okay.
Okay, and for the heart, this is the same. We can using the tools. The same is to going on more, going back, the blood go, and then we can be
Alice,
massage.
we're coming to the
Yes.
close of the show, so I just want viewers to know you actually teach this. You have a workshop.
Yes, I
right?
have the workshop.
And how can people get in touch with you?
You can go through my webpage,
What
and
is
then it's TCM 1-to-1 Health.
And anybody can learn this.
Yes, everybody can be learned. For the normal people, they can be
Awesome.
started.
Ladies, thank you very much. Thank you for watching tonight. I'm going to leave you with a Chinese proverb. It goes like this: when the heart is at ease, the rest of the body is healthy. Enjoy the rest of your evening. Much peace to you.